right, we're demonstrating how to place, position a baby for UVC on admission to the NICU. The first thing you have to remember is any baby who is 32 weeks or less will have a double lumen UVC put in. Any baby who is a potential transport to Fairfax will have a double lumen UVC. Otherwise, it's just a single lumen UVC. So, it's very important that you have your baby aligned and properly positioned. So, you want to take a neck roll and make sure,
Which is made out of just a t-shirt rolled up.
and you want to place it so the baby's chin doesn't fall and include the airway. So we want to make sure our airway is aligned. The baby's head can be up or it can be down to the side. All right. Now, if the baby were intubated, it would still be the same thing, and the head would be upward because the ventilator would be over here on a cradle. All right. So we have our baby on the bed. We're going to put the neck roll in. We're going to put arm restraints on the baby. Even if there's an IV in place, the arm has to be restrained. You can either use this or you can pin the IV board to the bed, but you have to restrain the arms.
And I normally just bring it up here, and then I just tape it back here so that it doesn't move. So these
Or you
will,
can tie it.
Or you can tie it.
either way, really.
Yeah, you can just, you don't want it super tight. You don't want to be yanking on the baby this way. Because you don't want to be pulling the arm very hard, but you do want it secure enough so the baby's not going to be, pushing his hands down, because we have to keep this area sterile. Then we have to restrain the legs. So this is a big baby. So we would take one of these and we would put it across the baby thusly. Now we want to make sure that we're not covering too much of this area, because I have to wipe this down with betadine.
And I also usually do one across the knee
Yes.
area as well.
But if you do that, make sure, and you should do it, but you want to make sure this is covered also.
Yeah, it would be covered.
Yeah, we just don't have a big enough one of these.
So we'll just do this. But make sure the tape doesn't touch the skin. All right? So once the baby is positioned, and it's also important that the baby be flat, so when we get our x-ray, we're getting a good x-ray coming straight down and we can see where those lines are. All right?
So, like
Then-
rotated, you can just shuffle.
If we have a little lead, the heart lead, we're going to put it over the gonads. Okay? And we can tape it down at this point. If we don't, and someone's looking for it, we can continue, and then we can wrap the lead heart in a sterile towel and just lay it over the baby. So we can proceed. So we're going to come, and the baby's positioned, vital signs are stable, and we're going to prep this area with betadine. All right? And then I will have an assistant holding a clamp on the baby's clamp, a forceps on the baby's clamp, and then I will tie a sterile tie underneath this, tighten it, and then cut the cord. The tie is to prevent any excess bleeding. And then I'll proceed to put the line in. So let's say I have the lines in, you suture them in place, get your x-ray. So when you get an x-ray, they're going to be putting the x-ray in through here. So you're going to have to release some of this tape. Then put your x-ray in. They'll take the x-ray, take it out. I'll go look at it, come back and say, good placement, or I have to readjust. Maintaining a sterile field at all times. Then let's say the lines are fine. Then I will double suture or double knot the sutures, and we should be ready to go. The venous line will be taped going down. Can I take this off?
Yep.
When we secure the venous line, you're going to secure it this way. So it's going down, and it's on the left-hand side. And if I had an arterial line in, you would flip it this way, upward a little bit on the left-hand side. And there's a picture right here.
So there's your example of the venous kind of down, the arterial up on either side. And so we'll do standard for this. It'll always be the venous on the right side of the baby, and the left side of the baby will be the art line.